fact is that we're making an immense progress in oncology and in cancer therapy. That is something which has to be mentioned and where patients really benefit from enormously, either be it by prolonged progression-free survival or prolonged overall survival or both, and sometimes in a better quality of life, which leads, of course, to much higher acceptance of the new drugs. The problem, of course, is that these drugs are not freely on the market. They, of course, are expensive. They, of course, generate costs, and these costs are generated mainly for social systems, for health security systems, etc. Now we find in very many studies, and one being a study from the United Kingdom, which is presented here, that spendings on drugs in oncology differ quite significantly among the countries of the European Union. And we know that thus the access to these new drugs, which either prolong progression-free or overall survival, is quite different in the different countries, leading to a probably discrimination between cancer patients living in different countries. We are witnessing quite an immense oncology tourism within Europe. We are seeing this, that patients are going to other countries where they believe that they are being served either better or even simply somewhere else, because there's this phenomenon of being served somewhere else, which patients would think that this is better at the same time. The consequence, of course, is another one where patients are truly spending a lot of money by themselves if the social security system does not pay or does not reimburse for these drugs, of course leading to a major or even quite a considerable financial burden, which is on top of the disease burden the patients have to carry anyhow. The official version, of course, would be that we have to harmonize our achievements and our goals within the European Union concerning registration of drugs, concerning reimbursement of drugs, and concerning the speed of reimbursement of drugs once they have been registered with the European Medicines Agency. Well, this differs enormously. There are, of course, rather neoliberal approaches where countries would think that patients have to pay for the drugs they're taking. There are other approaches where you would say that drugs are being reimbursed. It depends on the country very much. And of course, one of the major problems that we have is the major burden on countries of financially restricted possibilities. That is an enormous problem. What I'm missing and what I would very much like to see and encourage would be general discussion within the public, what we are standing for and what we want to have. Personally, I believe that in Europe, we should also overcome any kind of change or any kind of disturbance in biology. Because we do have quite a lot of decisions where healthy people are taking decisions for the sick ones, which I consider quite inappropriate. Because suddenly we find ourselves in a situation where healthy people, due to some economic considerations, would determine how long a sick person, quote unquote, deserves to live. And that is something which I consider quite unbearable.